Welcome back to Pain Diaries. Now we're going to take a deep dive into a topic that's received a lot of buzz recently. So let's explore the world of hormones and peptides with my partner, Dr. Matt Wiederholz. Welcome back to the show.
Thank you.
So let's talk about how we at Performance Pain and Sports Medicine provide comprehensive hormone replacement therapy using pellet therapy, peptide therapy, and nutraceuticals to enhance the overall well-being of our patients.
Yeah, so in today's busy world, I think you and I both know how challenging it is to get great nutrition. And so supplementation is a big part of a healthy overall diet and nutrition platform. And so nutraceuticals can be targeted for a multitude of reasons. I use nutraceuticals in my patients not only for filling in the gaps of where their nutrition may be lacking, but also for particular needs. So, for instance, inflammation is a big factor in chronic pain patients, even acute pain patients. And so we use various nutraceuticals to combat inflammation. That's also one of the pillars in the peptide therapy that I utilize in our practice. There's three main pillars when it comes to peptide therapy, the way I see it for my patients. The first and foremost is pain and inflammation. So we're using various nutraceuticals as well as peptides to treat pain and inflammation. The second is growth and recovery. It's so important for us to recover after an injury. If we're weight training is a small stress that the body endures on a daily basis, and we need to recover from that stress. And so pain and inflammation is the first pillar, growth and recovery is the second. And then in our practice, you're leading the charge on weight loss, and that's one of the other pillars of peptide therapy in our practice. And then to round it out, we have hormone optimization. Optimizing hormones, both, as you heard earlier in your episode, thyroid hormone and sex hormones, helps to relieve pain, helps to relieve inflammation. And so that's what we're doing in a natural way, using the body's own hormones as well as exogenous hormones, hormones that are being implanted into the patient that are the same chemical structure as the natural hormones that we produce.
Yeah, bioidentical, meaning the same chemical structure. It's pretty cool that us as humans have the same bioidentical structure of the hormones of the plant from yam, which, science is amazing.
Indeed.
So the benefits have been incredible. Our patients are seeing it. Our staff has fully embraced this. We're all living and breathing this healthy lifestyle now. And our excitement is contagious because we love how we feel. And we're so excited to bring that to our patients and the people that come see us who just can't seem to figure out what's wrong and how they can get that edge. So let's talk more now about the specific benefits and advantages of actual pellet therapy as the method for hormone replacement compared to the other conventional forms of treatment.
Yeah, first and foremost, these pellets are compounded specifically for you. So by being compounded, the dosing is very specific to each patient. Additionally, you mentioned bioidentical. So these compounded pellets contain bioidentical hormones. That means the same chemical structure, form, and function to the natural hormones that our body produces. So let me be clear. This is not steroids. This is not artificial hormones to try to increase hormone levels to a supraphysiologic state. What our goal is to restore hormone balance to a natural, healthy, youthful level. Essentially, how did you feel when you were 25? That's when you had really optimized hormones, most likely. And that's our goal, is to get levels back to a healthy, youthful level.
No, absolutely. And we always do this by checking blood first. We take a nice a sample of your blood and we send it to the lab and we check all the different chemistries in your blood, your blood counts, and then your hormone levels too. And thyroid is so important, vitamin D is so important, as well as the sex hormones, which you think of when you think of hormone replacement. But there are other hormones that we're looking at too, because those hormones are so important for the health and wellness, but also to alleviate pain and inflammation. So I know at Performance Pain and Sports Medicine, we assess and customize treatment plans for each patient to ensure their unique needs and goals are met, especially through this comprehensive approach that we provide. What ways do you educate and empower patients to really actively participate in their own health management?
I think overall, both you and I spend a lot of time with our patients trying to educate them. We provide both written and verbal education for our patients. So we've created flyers, educational flyers. For those patients who are interested, we have a number of medical studies that we can share with them. There's a lot of misinformation when it comes to bioidentical hormone optimization or replacement. Hormone replacement therapy, or HRT, has kind of a bad rap. And why is that? Well, again, the media has ran with bad information. And I think this was already discussed on your show today with Dr. Pete. And overall, when you look at the real data, if you look at studies looking at bioidentical hormones, the safety profile is very, very safe. These are natural hormones that our bodies produce in our younger years. When you go through menopause or andropause, if you're talking about a male, you're losing the hormone stimulation. All we're doing is restoring hormonal balance to a youthful level. Very safe, very effective, and it will help with pain, which is why we became interested in it in the first place.
No, for sure. And it's amazing the results patients are getting for their pain relief. There's so many studies that show, low testosterone in men, it's linked to back pain and joint pain. And, when patients start having their therapies wear off, that's the first thing that comes, to their mind. Oh, my joints are starting to hurt again. So it's pretty amazing how it's all linked. How do you normally stay up to date with all these latest advancements and research on hormone replacement therapy, peptide therapy, and nutraceuticals so you can continually enhance the quality of care that you offer to the patients?
Well, as physicians, you and I, we spend a lot of time at conferences. Conferences are probably the best way to see the latest research because the people who are publishing that research are presenting it at a conference. And so the two of us are attending a number of conferences every year. And so I think that's honestly the best way to stay up to date. Attend medical conferences. Most of these medical conferences also provide continuing medical education credits. So that's a double win for us. Not only do we get to hear about the latest information, but we're also getting our continuing medical education credits while we're there. There are also a number of publications that are published that we are reading on a daily basis. And those are the two main ways that we're staying up to date.
And I mean, these conferences that are associated with the associations for which we're attending, they have podcasts, webinars, and these are just sent into my inbox every day. So a lot of times I just plug in if I have a long drive or if I'm at the gym, I might want to listen to it while I'm working out. And it's just constant information with the latest and greatest research studies and technologies that are available. So I really want to thank you for being on the show again today. Is there anything else you want patients to know about our comprehensive approach at Performance Pain and Sports Medicine?
Just want to say, if you're looking for something different, if you're looking for something more natural, come see us at Performance Pain and Sports Medicine.
Absolutely. Couldn't agree more. Thank you, Dr. Matt Wiederholz, for being here with us today.
Thank you.
This is Dr. Manzi here with Performance Pain and Sports Medicine in Houston, Texas, and this is Pain Diaries. Take care of you so you can take care of business.